Bill, you have another person that you would like to introduce, if I'm not mistaken, which is our presenting sponsor. Am I correct, buddy?
Absolutely. Let me read this bio because this is impressive. Mike Riley is the president of Novant Health, Huntersville Medical Center. He served in this role since July of 2015. While in this position, he has facilitated incredible growth at the hospital. Bed capacity has doubled from 75 to 151 since 2015 to accommodate the community need. Mike's been in healthcare in various capacities for over 30 years. He started his career as a certified nursing assistant and then became a registered nurse and continues to be licensed as a registered nurse. He began working at Novant Health in 1999, where he worked as a cardiac staff nurse, and he quickly moved up the nursing ranks, serving as clinical coordinator, house supervisor, nurse manager, and director of nursing. And Joe, he is a former board member of the Lake Norman Chamber of Commerce, but he is the presenting sponsor of Small Business Week. But Mike, you're also—
This makes you proud, doesn't it?
Oh, yes. but Novant is also the sponsor of our Leadership Lake Norman and our Junior Leadership Lake Norman, two great programs that we run at the Chamber of Commerce. And Mike, thank you. Focus Fridays, also the presenting sponsor. Novant is really, really involved in the Chamber of Commerce and a great partner.
Yeah, we are always happy to be part of the Chamber. I think, Joe, you asked earlier the mix between big business and small business. And, Novant Health is a big business, but we serve small business. We serve everyone. And so it's really important to us that we connect with the entire Chamber. I think, Bill, you have well over 800 businesses. And that's important to us. I want to know what your business needs from a healthcare perspective. So it's huge for us, and we cherish that partnership that we have. And we're super proud to be sponsoring the Small Business Week.
Mike, we just talked about the tremendous growth that you've had at the hospital, and you continue to do so. Talk about some of the additions that you've recently added to the hospital.
Yeah, in 2018, we added a 44-bed wing. So we went from can't do that math that fast, 93 to 139, I think. And just recently we added 12 more in another OR. And about 6-8 months ago, we added a pediatric-friendly emergency department that was funded 100% from philanthropy, led by the Martin Truex Foundation. And the majority of the donors there were NASCAR, either drivers or affiliates. And so if you go into this PEDS ED, every room has a driver theme that the drivers or the businesses developed. So
that sounds like a lot of fun.
It is super cool. You go into the room and it's like you're in the pits with Joey Logano or it's really neat. And you think about kids. If you've ever been I think we've all been kids, or if we've ever had kids who break something or are sick or whatever, and they go into the ER, it's horrifying. I mean, we have always taken great care of kids, but it's a scary, scary place. And so you think about, you put a kid in a room next to a psychiatric patient, next to a patient who has cancer, next to a patient who has some other problem, and it's scary. So we've separated the ED. We've made it NASCAR themed. The waiting room is separated. And so it gives the kids a really a safer feeling experience. And so it's been, we've had great reviews. The parents, probably more important that parents like it. The parents like it. And the kids are really raving about it.
What do you think the motivation is that they wanted that to be built? Where'd that come from?
Yeah, I think, Martin years ago went to the hospital, didn't have a great experience. As a kid, didn't have a great experience.
Surprise.
Well, right, because it's a scary place, and you wanted to make sure that that kids could have kind of a different experience. And I think that's an easy theory to get on board with for the other drivers. You think about most of them have kids. And so to think about their kids having a safe place to go, or it's safe, but a fun place to go,
right.
A tolerable place to go when you're in pain or when you're hurt. I think that it was easy for them to get on board with that.
I can relate to this. My son's got diabetes, and we spent many of days in a hospital, especially the first days when you didn't know. And things like what you're describing make all the difference.
It does. And another thing that we have in the PED is a child life specialist, which they are professionally trained to make that entire experience less scary. A good example, an MRI. The MRI, I'm scared to death to go in an MRI. But imagine what that's like for a kid, and they turn this into a play experience where you're going into a submarine, or they use dolls to say this is what when the doctor comes in, this is what they're going to do to you, and so when they come in, it's not a scary thing for them. So as much as the aesthetics that comes with the NASCAR theme, the child life specialist does that much more for the kids.
I think the thing I was fascinated about, Joe, was the number of race teams that were sponsors of rooms. It was a lot of Lake Durham and Charlotte area teams.
It was, and it wasn't one. They all compete every week, and it wasn't one team. And they actually got each other when Martin and Cherry got involved. They pulled in Gibbs. They pulled in the other drive teams, and so it's not just a Gibbs team event. They're from all different teams throughout.
So, Mike, I'm curious. A little bit later on in the show, we're going to bring in Tracy. Tracy and I like to fight about this mental health because I grew up. You rub a little dirt on it and you keep going, right? So we'll fight about that later with Tracy. How are you guys handling that at the hospital? Because it seems like mental health is more and more on the forefront of healthcare. Can you talk a little bit about that?
Yeah, it is a national crisis. In all honesty, I think we are doing everything we can to get ahead of it. Meaning, by the time they get to the hospital, they're having a crisis and it's too late. We're trying to put things out in the community and partner with community entities that take care of mental health ahead of time, getting them to therapy, getting them medicated. My wife is actually a behavioral health PA, so she does this every day. But finding ways to do outpatient work so that they're not in crisis, because there are far, far, far too few mental health hospitals anymore. And so if you're in crisis, it's not uncommon for me to have 4, 5, 10 psychiatric patients in the ER in Huntersville waiting for a bed at Broughton or at one of the big institutions. So
Mike, I'll tell you, my sister's a therapist, and I tried to talk her into going out on her own. Surprise, surprise. That's what I do, right? And I can remember her telling me, I need at least 12 to 15 patients to make the same money I'm making now. I don't know if I can do it. And within less than a year, she had over 120 patients. The amount of need for mental health issues is off the chart. Why is that? What has happened that this seems to be an issue? It just seems to surprise so much of us, and it seems to be this generational thing that's happening.
I don't know how generational it is. It may be just, and this is, I am not the expert on mental health, so this is a little bit of pontification, I guess.
Don't worry, we got the expert coming in a little bit to clean this up.
I think resources is a big issue. I think I think forever, we've had psychiatric hospitals, the large, Dorothea Dix, Cherry, all these hospitals throughout the state and throughout the country who took patients in. I think those resources are gone, and then on top of that, the reimbursement for that is not good. Not just for the psychiatric hospitals, but for outpatient care. If you're doing outpatient work, you're probably not making as much money.
Right.
In your sister's case, right. As if she was a general practitioner.
Right. And
so people are kind of self-selecting out of the field, and so there's not as much help for people that are out there. So you have. Yeah, I don't know if there's larger numbers necessarily per capita of mental health issues or people with mental health problems, but there's fewer and fewer and fewer resources, and it kind of continues along those lines. I think I hear you talking about how it's more acceptable to talk about it, which is a great thing, I think, because it gets it out there and it keeps people from, I don't know, blow is the right word, but they keep it in, and then they have a break. And it's better to talk about it and get it out. But there's not as many. My wife, great example. There's not as many resources as there could be.
That's interesting.
Yeah, my wife is, I mean, back to back all day, and there's probably a waiting list to see her, 100 or 200 patients long. Yeah.
Mike, let's stay on the issue of cost and price transparency. And you brought up MRI a few years ago, and I think now In 2021, I think now hospitals and healthcare providers have to be upfront about certain costs.
Mm-hmm.
But a few years ago, I had to get an MRI. My doctor referred me to a healthcare provider. It wasn't Novant.
That's your first mistake.
Yep. We're going to talk about that.
Mike, can we get a copy of that? I want to throw some darts at it.
I got down there. And they told me my out-of-pocket expense was going to be $1,000. And okay, bill's cheap. Okay, $1,000, really?
No, I'm with you on that. That sounds a little heavy.
So I said, I don't think I need it that bad. Then later on, I started thinking, you know what? What if it turns out to be more serious? So I went ahead and went down there, $1,000 out of pocket, got it done. Got the bill for $2,700, which then I was told, everything is fine, Bill. You checked out. $2,700. And I called them up and said, well, wait a minute. You told me $1,000. Well, that was $1,000. But then you have this, and you have this, and you have this, and you have this. You go down and you get your car worked on. They're going to say, here's what it's going to be. And you can say, no, I don't think so. Now, again, first mistake, different provider. But that shocked me. And again, I had to pay it.
So Bill, here's the thing. Mike's not coming back if we make him talk about mental health and his billing price. You understand that, John?
He didn't bill me.
We're going to make him answer this question, but I don't think he's coming back after this. You understand that, don't you?
But
go ahead, Mike.
I am happy to come back. But price transparency is a big issue today, and you're hearing legislators pass laws to require hospitals to transparently list their prices. And I think the problem with that is that's actually probably more deceptive than the way we do things now. And the reason I said that, you take your MRI, we may, and I'll make up numbers because I don't know what we charge for an MRI, but we may charge $5,000. Mm-hmm. And the hospital down the street may charge $4,000. And so when you look online and you see I charge $5,000, the other hospital charges $4,000, you're like, ooh, I'm going to go here to this hospital. But the problem is your insurance coverage. With me, you may have a $500 out of pocket, and that's all you pay. Whereas with the other one, you may have a $2,000 out of pocket. So if I just show you the charge, it doesn't really do a whole lot. What we have at Novant, what a lot of health systems have, is they have a number where you can call, and they'll ask you all the questions they need to ask you. What's your insurance? How much deductible have you paid? How far have you gone so far in the year? And they'll say your estimated out of pocket is going to be this. And then that way you can compare place to place. So that's unfortunately the charge in healthcare rarely is what you pay. It's usually significantly less. I'll tell you, at Huntersville, the rate that we get paid on per dollar charge is about 29 cents. So what we charge, we get about 29 cents. And Huntersville area, Lake Norman is a nice, relatively affluent area. In a lot of rural places, it's in the teens. So it's not, the charge is not really based on in reality. So when you look at the charge, it's not what you're going to pay. So that's something that's important. And then, Joe, I don't know if you want to go on and on about healthcare economics.
We'll take this any way you want to go, Mike. I was trying to give you an out,
but part of the reason for that is that we usually get the insurance companies will say, we're going to pay you that for that $5,000 MRI, we'll pay you $3,000, mm-hmm. and then we'll have the customer pay $500 or whatever, and so that $1,500 we just lose, and that's just kind of the way it is. And then people say, well, why don't you drop the price to $3,500 or whatever that difference is? And the reason is some insurance companies pay a percent of charge. So if I'm making all these numbers up, ending companies, but let's say Blue Cross pays $3,000. If we bring our cost down to $3,000, maybe Aetna pays 50% of charge. And so then if we bring our cost down to $3,000, Aetna pays us $1,500. And
so, Mike, I'm curious, do you negotiate these rates and what? So part of your job is sitting down with each insurance company trying to negotiate something that's fair and reasonable.
Right.
Okay.
Right.
Got it.
which is a whole
Oh,
nother.
yeah. I don't want the job, buddy. Justin, you had a question?
I did, and so I have two children that were born in Huntersville. So I appreciate, thank you for the staff. But one of the questions I have is, as you think about community and the needs of the community, how do you guys balance that with the things that like corporate wants to push, right? Which everyone knows the conglomerate of Novant, right? But you've got a local community to focus on. So what's been your mantra with your team to really focus on what the needs are of the Lake Norman area?
Sure, and we're talking about finance, but that's the lowest. We have to make enough money to survive, but that's the lowest of priorities. Quality, safety, making sure we take care of the community is the number one thing. So as a hospital, we're there for you all the time. Historically, the way healthcare worked, or the hospitals worked, was all we really cared about, was taking care of you while you were there. Well, that's expanded greatly over the last 5 to 10 years. Now, I don't want you to come to the hospital. I want you to be well. I want you to see your physician every year. I want you to get your colonoscopy, your mammography. Your mammograms. I want you to take care of yourself so that you're not in the hospital. And if you do come to the hospital, now instead of a box, the hospital being a box, and when you leave, you're on your own, we've got a system of support so that we make sure that you get to your physician after your discharge. We make sure you get your medicine. We make sure you get physical therapy, whatever it is you need, because we don't want you to come back. Again, we're always here for you, but we don't want you to come back.
Did you want me to dish out the phone number too, so people can call in with their claims, complaints? We can do that if you want to.
Please don't. Hey, guys, stop picking on Mike. Will you guys stop picking on him?
Mike, on that same theme, speak to the sports performance and the wellness programs that Novant does.
Yeah, that's another great example. We have programs where we work, sports performance programs where we work with kids, teams. Swim Mac's a good example. We do some work with Joe Gibbs Racing and lots of other sports teams, both big and small. And the way we look at that is sort of a continuum as well. If it's just a team that needs to train, we've got trainers and facilities that can make them bigger, stronger, faster. If they're people like me and you we're getting up there and we're still weekend warriors. But
add me to the list.
we can make you bigger, stronger, faster. Or when your knee goes out, we can fix your knee. We can do surgery or whatever it is that you need. And then we can move you into physical therapy. And then we can move you into training again so that we can move you back and forth in and out of the continuum from bigger, stronger, faster to fix whatever the problem is to then rehab you so that you're back to what you were doing before. So it's a nice continuum all the way through.
And we were talking about a cost a while ago. So there is significant cost differences between emergency department, urgent care, primary care. Can you speak to that issue?
Yeah. I think that's something that I really recommend people kind of evaluate what their issue is. When you walk into the ER, just walk in for whatever it is, whether it's a train wreck or a thumbnail or a hangnail, it's $700 to walk in the door. Now, and then we won't talk about how we get paid and all that, but that's in charge to walk in the door. Urgent care is, depending on where you go, significantly less. And then what a lot of people don't know is most certainly Novant Health's primary care doctors have slots for you to go in same day. And if your doctor is overwhelmed and so busy that we can, there are other Novant docs who have availability the same day, and that is even cheaper than the urgent care. So depending on what it is, again, if you have a serious emergency, go to the ER. Don't tell people Mike said don't. Go
Right.
If you are in trouble, get to the ER. But I would just say educate yourself on the other options, the other less expensive options that are there, like primary care and urgent care.
Justin, you had a question?
Yeah, it's communication, right? As we're talking on the radio, you're talking into a microphone right now, right? But it's a big thing for people of knowing where things stand and understanding that things take time, results take time, things like that. What are some of the things Novant's trying to do to help communicate to people? Because I'm sure it's a big complaint across the board, right? Not saying it's somebody's fault, but in general, communication is key. What's kind of the short-term things you guys are using for strategies, and what's like a long-term vision on communication for Novant?
So the biggest thing that we use is MyChart. It's I don't know if it's the computer system. It's an app where all of your medical information is there. So whatever what your doctor sees, essentially in real time, you see that, and that's been incredibly helpful. We use that not just for medical information, but for appointments, for paying your bills, for everything. That really we send out through MyChart updates on new programs that we have, those kind of things. So that's the biggest way that we have found to communicate with patients, and it's been really great. The other thing with the system that we use, we can communicate medical information through MyChart or Epic. The big system is Epic, to other facilities much more seamlessly than, years ago. You would go to the hospital, print off your chart, take your chart to wherever you're going. They would make copies of that and then put this in your new chart. Now it's pretty seamlessly, but goes back and forth.
I want to remind everybody, we are talking with Mike Riley. He is the president of Nobel Health, Huntersville Medical Center. Mike, thank you so much, buddy. We genuinely appreciate you being here. Mike, you don't know this about the show, but we have approved random questions that we ask small business people. We got a special approve random list created by my company factotum, Julie. Everybody needs a Julie. These are CEO questions. So we're upping the scale for you.
I'm scared.
Are you ready for this?
I'm scared.
He is flapping that paper hard at you.
Those of you that are on the radio, I wish you could see him give me that look. I'm scared. Relax, you can handle this, buddy.
But are they going to be on the sexy channel?
Yeah, I don't know. Mike, it's a great question. Now that we've got a new owner, I'm not sure where this is being seen right now, to be honest with you.
It means Joe's got to give me his password, but that's a different conversation.
Okay. Here is the official random question that we ask CEOs. What type of corporate culture are you trying to promote, and how do you create it? That is really hard for small business people to do and understand.
Actually, that's a great question. Thank you. I was really scared.
You could thank Julie for that.
Thank you, Julie. So it's interesting. So I think my mother asks me all the time, "What do you do all day?" And I'm like, "Well, I walk around and say hi to people." But I think creating culture is probably the most important thing you can do. I think being around people, finding out what's working, what's not working is the most important thing you can do. And how do you do it? You walk around, and this is, Mom, you walk around and you find out what works, what doesn't work. I think if you have a good culture, you can make difficult changes. You can get through some tough times. I'm telling you, the last 3 or 4 years of COVID was tough times for us, and the culture was such that we were certainly strained. I won't tell you it was glorious times, but we were certainly strained. But the culture is good. The team, I think about Huntersville, they like each other. They're in it for the right reasons. Healthcare, I think, is easier than many industries in that the why is pretty easy. We're here to help people. I tell people every day, you go to work, whether you're the finance guy or the nurse at the bedside, and you can make a difference in somebody's life. And not all businesses are like that. So the why.
That's
really
a true statement.
Yeah. And making sure that everybody appreciates that. As I walk around, it's funny, I'll talk to the frontline team and I'll say, "What did you do today?" And they'll say, "Oh, we just had it's Tuesday." And then I will dig a little bit, or I'll go and talk to some patients. And I find out that these people did amazing.
They changed the lives of 20 people before lunchtime.
Right.
Yeah,
and to them, it's Tuesday. And I tell them that, what they do in one shift, they'll forget about tomorrow, but the person whose room they were in will remember that for the rest of their lives. So it's just, I don't want to say it's easy to create culture, but I've got a nice why to use.
Mike, you replaced Tanya Blackman as the administrator who went on to be your diversity, equity, inclusion officer. But what have you enjoyed most about working in Lake Norman, particularly in Huntersville?
Yeah, it is a great area. I think Joe was talking about the lake and how that brings a certain kind of person. I think it's true. I think there is a spirit of community here that you probably don't necessarily find in a lot of other places. Novant's a big company, and we have a corporate HR department. And I demand that when they recruit nurses or recruit doctors or whatever to here, there's a picture of a lake in the back. It's just, it really makes this place sing. It's just a great community.
Justin, you had a question?
Well, you mentioned coming out of COVID and the, hard times, and personnel obviously is a big part of that conversation. Where do you guys stand now with personnel? Are you guys at full staff? Should we do an all call and start doing job applications right now? Where are you guys at?
So before COVID, there in the United States there was I'm going to get the numbers wrong, a 500,000 nurse shortage. After COVID, it's 850, 900,000. So the nursing shortage actually has gotten worse since then. At Huntersville, we're doing okay. We're doing better than most, but there's still a huge challenge there with the way nursing has been for a long, long time. There just have not been enough of them. COVID made that worse. A lot of nurses, if they were nearing retirement age, they went ahead and retired. A lot of younger nurses, I was talking to my team the other day about this, probably 50%, give or take, of the frontline team started in the last 4 years. So all they know is combat nursing, which is a completely different kind of nursing than, we take care of people and we care about people and we holistically see them. For the last 4 years, we just wanted to get, we just wanted to get through the shift. And so now that we're sort of changing that paradigm, we talk about culture, we're trying to kind of re-educate nurses that there's more than just combat nursing. I call it combat nursing because that's kind of what it was for a good period of time.
And you're also in an area where the population is increasing and increasing and increasing as the years go on right now. It's a good problem to have. Don't get me wrong. How is that factoring into that training for you guys right now?
Yeah. And if you look at the population growth in the Lake Norman area, I think over the next 5 years, it's a 6 or 7% annual growth rate. For age 65 and up, it's 22%. So what's happening is we're getting more hospital-aged people, and the people who take care of them are not growing. The population of those people are not growing as fast, and that's kind of throughout the country. As the baby boomers retire and age, they need more and more care. But a lot of those baby boomers were nurses, so they're getting out of the occupation while they need the care. So it's certainly a challenge.
Mike, I've known you for probably a decade, and I've never asked this question. And I know you started off as a nurse. Why did you go into healthcare?
You stumped him.
Yeah, well,
you stumped him, Bill.
It's a long story. So it's funny. I went to NC State. I was working as a mental health technician. I worked in a psychiatric hospital for all during undergrad, and when I finished, I got a small promotion. Basically, was doing the same thing as a mental health, kind of like an orderly. I became an orderly that ran groups after that, and the nurses were, working alongside me, and I'm like, I could do that. And so I went back and got my 2-year associate degrees. Well, I got my 2-year associate degree in nursing to be a nurse. But the thing that kind of tilted me when I finished my undergrad, I was like, well, do I go to grad school or do I go to nursing school? What do I do? I was at a James Taylor concert. This shows my age. And this lady from afar said, Mike. And I said, oh, and I gave her that look like very vaguely familiar. And she came over and she was with her husband and she said, hey, Johnny, this is Mike. He used to go into Granddaddy's room all the time and he would give him sports magazines and they would talk about sports and he was just great. And I said, oh, well, how is he? And he said, oh, well, he died a couple weeks ago, but he was so thankful for you. And anyway, it was that sort of made me decide, this is a really neat thing that I can do. So that was the thing. You asked that's the long story.
Bill, the truth is he has one thing I have very little of, and you can tell empathy for people. He actually cares for people, Bill. You can tell that comes out. Mike, thank you so much, buddy. I really do appreciate it. We got to go on, but I want to ask you one final question. When you have a new hire, how do you quickly get them to see and embrace your values and the vision of the culture? How do you do that?
Yeah, some technical ways, I guess. We have a new hire breakfast where I have all the leaders come in. It's about an hour long breakfast. We have a little PowerPoint presentation. We show what happens in the hospital, and then we go around. There's more to it than this, but each leader talks about who they are, what department they run, how long they've been there, and then we do a fun fact and an icebreaker, kind of a game, and that really seems to work. And then after that, I myself and one of my directors do a class on, we call it H3 class, Heart, Head, Heart, and we talk about the importance of kind of the stuff I was talking about earlier about how we're here to care for patients. And it's not, I tell people, if you got into healthcare to make a whole bunch of money, you probably made a bad decision. It's really, you should get your joy and your reward from what happens with people.
Great. Mike, thank you so much. I'm sorry, Justin, do you want to ask
Well, I think one way you could build the team quickly, just have them all start taking blood from each other right there in the room. That would get me going real fast. So just saying, throwing that out there for what it's worth.
I'll put that under advisement.
That means stay out of healthcare, Justin. That's what that means.
Yeah, not a problem. You don't want me touching needles and knives and all that.
Mike, thank you so much, buddy. You're going to hang around for a while, Bill? Is he going to be able to hang around with us for a while?
If he wants to.
Mike, thank you so much, man. We really do appreciate it. And thank you so much for sponsoring this event. It means a lot to us and small business people in the area.
Absolutely. It means a lot to us, too.